you can get them off of Amazon. But just thinking about the lighting in general, you want to be able to see what you're cutting and what you're doing. And a lot of times when we're working, we're blocking the light above us. So just adding some lighting. A chair, that's a simple solution. If you're getting tired when you're cooking, to sit down and take a break, breaking down the task, maybe chopping and prepping and setting that aside and going to take an actual break and then coming back to do the physical cooking task. And then there's a ton of different modified utensils for cooking to make things easier if you are having difficulty with fine motor coordination or range of motion or trimmers. So there's a lot of different modifications. Going into our bedroom. So looking at having a nightlight. I hope most of you do have a nightlight, but you could have one next to your bed. You could have one in the hallway going to the bathroom, but nightlights are a great way to increase your safety, especially if you are getting up at night. This picture right here has a picture of a bed cane. This is a great idea so you can keep items close to you, but also if you are getting up and down and having that difficulty, you can use that bed cane to help you get up and down easier and safer. It also helps with the safety of transfers, getting in and out of bed. A hospital bed or a lift chair recliner are also great options to increase your safety. Sometimes insurance will cover some of these, most of the time not, but these lift, lower, recline, and allow you to get into a position you need to increase safety with your transfers. Making sure that you're able, this is just in your home in general, that you're able to open and close all your doors. So a lot of us have knob doors that we turn, and sometimes that can be difficult if we have arthritis or decreased range of motion in our hand. So looking at maybe a lever door that you could just hit with your hand. And then just in general, looking at our furniture layout, we walk into a lot of homes that have clutter, that have a lot of large furniture items. So just moving things out if they're in the way, making sure you can get around, making sure you can get your walker in and out if you need that, so that you are decreasing your risk of falling and tripping over items. Home modifications if you have low vision. So here's just a few tips. I'll go through these quickly. But bold color tape, you can put it on doorways, on the edge of steps. You can put it on the microwave so that you can see that item that you're looking for. So colored tape is great. Again, removing rugs, removing trip hazards, removing clutter, making sure you can get in and out of your room safely. And we talked about lighting in the kitchen, but just lighting in general, making sure that you have lighting throughout your home so you can see where you're going. Here are some resources for just adaptive equipment supplies in general. If you need these, again, we can always come back to this again, or we can email them to you, but these are loan closets. So you can borrow items for free or even try them out if that's something you're wanting. And then there's some options on here like accessible systems where you could actually buy equipment if you are needing it. So home modifications, if you are concerned about some safety in your home, or if you're just wanting some safe recommendations, reaching out to us is great. Insurance covers occupational therapy and physical therapy visits to come in and give you a personalized home recommendations. And also then we can help with resources to getting those items paid for. If you are on Medicaid, there is a whole nother program that helps pay and fund for home modifications to be done. So reach out if you have more questions about that. Lighting, some more tips. Lighting, we've talked about that. Have good lighting, remove all your throw rugs. Throw rugs just are not safe. I've said that over and over. Have items within reach. Wear good shoes or slippers around your home so you have secure on your feet, and remove clutter. We just have a lot to talk about. So here goes Jenny.
Okay, so we're kind of going to transition into thinking about why we should stay strong at home as well. So yes, we can modify our home and we can do some different things and make some simple modifications to make our home more safe. But then how do we make sure our body is also strong and our balance is good? And what can we do while we're at home? So, why is it important to stay fit and strong? Muscle strength is directly related to falls, and falls are actually the number one cause of injury for adults over the age of 65. You all probably have heard that so many times, what can we do to reduce your fall risk? But that's really something that we want to take to heart and see what we can do to help. So one of those ways is just staying strong. So what do you need to do? How much activity do you need? So they recommend 150 minutes a week of aerobic activity. So that doesn't mean that you need to like go for a run or do something, really intensive, but something that gets your heart rate up. So that could be golfing. The little pictures on here show swimming, yard work, gardening, anything that just even like a walk, a brisk walk, playing with your grandchildren, things like that. And then also 2 days a week of strengthening. So again, that doesn't mean you need to go to the gym and hit the weights hard, but we're going to give you some exercises you can do at home. But just things that are going to make your muscles work, get them stronger. So what are the benefits of strength training? So this is increasing your muscle strength. So regular exercise, so 2 to 3 days a week, will build your muscle strength and your muscle mass. So muscle mass decreases as we get older. So we want to make sure we're preserving that bone density, keeping our independence. So that will help us be able to continue to live at home and continue to do the things we want to do. And also it helps keep your brain sharp and decreases your fall risk along with that aerobic exercise or that exercise that gets your heart rate up. And then it also gives us the ability to reduce our risk of osteoporosis and the signs and symptoms of multiple diseases and conditions. So things like heart disease, diabetes, depression, cognitive decline. So exercise can actually help decrease dementia, the symptoms of dementia. It's not going to make it necessarily go away, but it can help with some of the cognitive aspects as well. And then also it improves our sleep. So how do we strength train safely? The number one thing is really education. So are you using the correct form and are you being safe? So we don't want you to just pick up like 10-pound weights and start doing exercises, right? We want you to start small, work your way up, and then same with the repetitions. We don't want you to just all of a sudden do like 25 reps, right? Trying to start with 1 to 2 sets of 8 to 15 reps is great. Making sure you're breathing correctly and listening to your body. And then again, like progressing the exercise. So making sure you're talking with someone, slowly increasing the weight, adding more reps, different moves, seeing, maybe you need a little modification. Maybe you should do some things sitting. Maybe you could do some standing, but maybe you have a chair close by, things like that. And then trying to mix up what you're doing as well is really great for your body and your muscles. So as we said, exercising regularly can help keep both your mind and your body healthy. I'm going to go through a couple exercises you can do, but I also wanted to point out this YouTube video, which I have pulled up. So let me see. We're not going to watch it, but I just wanted to show it to you, and I can send you that link if that's helpful. But it's just a 20-minute seated exercise. I'm going to play it for a second. I don't know if you'll be able to hear it, but
Yeah, I don't think the sound is coming through.
okay, that's okay. I just wanted to show you there's some modifications, which I think is nice. And again, you can just go search on here, 20-minute chair exercise, sitting down, and it will come up and it shows a little bit more intensive. So he's moving his legs and his arms, and then kind of a modification as well if you're wanting something not quite as intensive. So those are great. And you can do that on, sorry, say that again.
Would you mind throwing that video link into the chat?
Yes, I will.
Okay, thank you.
Yeah, let me do that right now. And then I'm going to show you some other things that you can do as well. Hang on, let me make sure I send this. If I send, okay, we'll do this. I might just send to you, Walker, but you can share it then. Okay.
Jenny, we are close to 12:30. So you can go through some exercises, but also we could send something.
Yeah, that's great. I'm just gonna go through these quick. I'm not gonna actually do them. But the first one is just a side stretch. So we would want you to start with some stretches first, but kind of prepare your bodies and your muscles before you just jump right into things. So a side stretch is great. These again are simple things you can do, while you're literally sitting watching TV. A hip stretch, so just bringing your ankle over your knee, both sides. If you want a little bit more of a stretch, you can lean forward, hold it. We want to make sure you're holding this. Even it says 10 seconds, but I would say even longer, like 30 seconds ideally. A back bend, shoulder press, so just starting by your ears, pushing up towards the ceiling, back down. And again, you can always modify. If you have a rotator cuff injury or something, you could just do one side, or you could do no weights on one side. Listen to your body. And again, you could always talk to a professional, your doctor or a therapist or a trainer as well. Shoulder raises, a chest press or a wall push-up. So it's kind of the same idea. Just starting at your chest, pushing forward. Twisting, which is great for your core. Calf raises, knee extensions, chair squats. I think chair squats, if you had to do an exercise, this would probably be one of the best ones to do, but you want to look at your technique and making sure, like in this picture, that your knees stay within line of your toes. You don't want your knees going way over your toes. You want to keep your bottom back like you're sitting down in a chair. And then just a couple arm exercises I threw in here. Tricep extensions, so just pushing the weights back as you can see in the picture. Bicep curls. And then seated rows or standing. She's standing, but I would say you could sit. You're just going to pull your elbows back and squeeze your shoulder blades. Those are sort of just generic exercises we would recommend to start with. But again, if you're wanting more like personalized exercises, definitely reach out to your doctor and ask if you can see a therapist. Therapy is covered by insurance, whereas personal training typically is not. But yeah, I think that's a great starting point. And again, I'm happy to send those exercises as well. I'm going to stop screen share and send it back to Walker.
Links today in an email tomorrow. So keep your eye out for that. But yeah, so Dr. Lippert is going to present now. And we're in the whole stretch, but thank you all so much for staying on.
Thank you all. Let me share my screen here. And you're seeing this now? Can you hear me okay?
Yeah.
Awesome. Thank you. So I'm here to talk a little bit about just staying independent by preventing falls. And I'm really going to build off of a lot of the things you've already heard from Erin and Kylie and Jenny. So thank you all for those great presentations. And this is going to be really right in line with those. I'm an internal medicine and geriatric medicine physician, and I practice at Kaiser Permanente in Longmont. And we'll get started. So the bad news is that falls are really common, and I think we probably all have either experienced a fall or know somebody who's had a fall with a significant injury. Every second of every day, an older adult falls, and more than 1 in 4 older adults report falling in the past year. We already heard that falls are the #1 cause of injury and death for people over the age of 65. And every 20 minutes, an older adult dies from a fall in the United States. Many falls don't cause injury, but 1 in 5 does cause a serious injury, such as a broken bone or a head injury. And even if you don't have a significant injury, a lot of people who fall become afraid of falling. And when you're afraid of falling, you kind of cut back on your activities, and that causes more muscle weakness, and that actually increases your risk of falling even more. So it's really important that we pay attention. And really, I think when we think about falls and injuries, one of the most dreaded complications is a hip fracture. 95% of hip fractures are caused by a fall. And in a study that was published, actually, this is a typo, it was in 2000 in the British Medical Journal. 80% of women surveyed would rather die than experience the loss of independence and quality of life that results from a bad hip fracture, requiring nursing home admission following that. So it's really important to everybody that we maintain that sense of independence. That's one of the things that people fear the most as they get older. So that was the bad news. The good news is that most falls can be prevented. And falling usually has a whole bunch of different reasons behind it. So it's really important to determine all of the risk factors for falls and address as many of them as possible. So I'm going to give you a checklist of things to think about in terms of preventing falls. And we're going to go through each of these in a little bit more detail. So first of all is please feel free to talk openly with your doctor about fall risks and prevention. This is something, whoops, I'm so sorry. I didn't mean to do that. This is something that is so important to your quality of life, and it's something that your doctor can help you design a personalized care plan around fall risk reduction. Review your medications with your doctor or pharmacist. Exercise to improve balance and strength. Make your home safer to avoid falls, reduce that clutter. Have your eyes checked. Make sure you're wearing the right glasses and footwear. And for women over 65 and men over 80, if you haven't yet had a bone density test, talk to your doctor about that. And if you do have osteoporosis or low bone density, talk to your doctor about treatment options. We have some great options available. So what you can expect from your doctor when you talk to them about fall risk reduction and prevention and your concerns. They should listen to you. They should listen to your story, to your history of a fall, if you've fallen, what were the circumstances, or if you're just worried about your balance not being as good as it used to be. So really fill them in on what is your concern. They should watch you walk. I think watching somebody get up from a chair and walk, whether you need to use an assistive device like a cane or a walker or not, it's a really valuable tool to assess fall risk. They should do some simple things to check your balance. I oftentimes will have people try to stand on one leg at a time just for a second or two. I'm right there to help support them, or I use a chair as a support. Not everybody can do that. I do things like check for vibratory sensation and reflexes and things like that. I think it's really important that your doctor look over your medication list, because some medications can contribute to a fall risk. And then sometimes we need to order labs or, again, that bone density test. Medications are really important. I think that a lot of times as people get older, they don't realize that some medications don't necessarily need to be taken for forever. And your body changes as you get older. And some medications just are metabolized differently. Doses may need to be adjusted. Sometimes it's a combination of medications that have just kind of accumulated over the years that just aren't working together very well. So it's really a good idea, especially if you're on a lot of medications, to talk it over with your doctor or pharmacist and make sure that all those medications are still needed and that they get along well with each other. And see if there's anything that might be safely stopped. Don't stop taking any prescription medications without talking it over with your doctor or pharmacist. The one thing that's over the counter that I always like to talk about in any fall talk I give is the PM products, or Benadryl or NyQuil. Really any medication out there that contains diphenhydramine, that's the active ingredient you'd see listed. This is a medication that is on a list of meds to avoid if you're 65 and older, because it causes all sorts of potential problems, including an increased risk of falls, confusion, car crashes, and even long-term use is a risk factor for developing dementia. So it's really important that you're not taking these medications, not long-term, not even short-term. There are safer options out there for any of the ailments that these products treat. So just avoid the diphenhydramine. Exercise to improve balance and strength. So many exercises help you with balance and strength, and Jenny gave us a whole bunch that that look excellent. So check out those exercises. I think that's great. From a fall risk reduction standpoint, one of the most widely studied and best studied exercises is Tai Chi. Some research studies show that practicing Tai Chi can reduce your risk of falls by 60%. And again, oftentimes these are provided at local, senior centers, rec centers, places like that. There are, chair modifications. So if you can't stand while doing this, there's Tai Chi that you can do sitting in a chair. So while Tai Chi really has great evidence behind it, I recommend finding something that you really love to do, that you enjoy doing, and then do it consistently, because I think consistency is key with exercise. So just make sure that it's something that you like. I feel like I don't really need to talk about make your home safer, because we've had a couple of great presentations on that. But again, just remove that clutter, make sure you've got some grab bars or secure railings where you need them, and focus on that lighting. It's good to have your eyes checked at least once a year, sooner if you're having problems. And if you do need an updated eyeglass prescription, make sure that you've got an up-to-date one. The other thing that I always like to point out is that, interestingly, wearing bifocals can increase your risk of falls outdoors or on stairs. So if you are a person that uses bifocals, it's great to have a pair of glasses that is just your distance vision, not for seeing up close. And those are the glasses that you'd want to use, what you'd want to wear if you're outside walking around, or if you're, going up and down the stairs in your house to do laundry or something like that, because you can understand that if you look down while wearing bifocals, that's great if you're reading a book. But if you're looking down to see where your feet are on a step or an uneven surface, it's not going to work so well. So it's something to think about, maybe having a pair of glasses that doesn't have the reading component to it. The other thing is wear the right footwear. So a good pair of walking shoes is really best. And even in the house, I think it's a good idea to have some nice, secure, skid-proof shoes that you're wearing for indoors. Going barefoot or wearing slippers or socks can actually increase your risk of falling tenfold. I always tell people, they're called slippers for a reason. They make you slip sometimes. So while there are probably some slippers out there that have decent traction, it's really a good idea to wear something that's supportive and secure. And then I could spend a whole hour talking about screening for and treatment of osteoporosis, but I feel like I need to talk about falls and fall prevention. One of the things we really care about is not breaking bones. And so there's very good evidence for women age 65 and older that every woman of that age should have a screening bone density test. Men have not been studied as well, but the general recommendation is men 80 and older should have a bone density test for screening purposes. Some people need to have it done at younger ages if they've got certain risk factors or if they take certain medications. So talk to your doctor about it. But if you have osteoporosis or low bone density, there are very safe and effective medications available that decrease your risk of breaking a bone by 40 to 50%. And many medications that we have don't work that well. They're not that effective. So this is a particularly effective medication available, actually several of them. And it's absolutely worth thinking about doing that so that you don't end up with that hip fracture. I also wanted to just make sure that you all had the website for the CDC. So the Center for Disease Control and Prevention has a program called STEADY, which stands for Stopping Elderly Accidents, Deaths, and Injuries. And they have a whole wealth of information about fall prevention available at their website as well. So I just wanted to point you in that direction as another great resource. And that's just that www.cdc.gov or gov that you can get to that website. And I think that was all that I had